Hello and welcome. I'm Michael Taylor. I work at Manchester Met University, and this is another in the Live Better virtual series where we're talking to people in leadership positions at work, people who run businesses, run teams, or people who are just thinking about the workplace and how it affects you. We've had a different guest on every occasion when we've done these. We're running them live, but also we know many of you will be accessing this in your own time, which is just fantastic. My guest today is Kayleigh Frost. Kayleigh, welcome. Tell us a little bit about your business, what you do, and what you're here to talk to us about, the whole issue about supporting employee well-being and people coming back to work or back to the workplace. Kayleigh.
Thanks, Michael. Yes, my name's Kayleigh Frost. I'm the Clinical Support Manager at Health Assured. So we're a Manchester-based organisation, but we are the UK and Ireland's leading EAP service. So in terms of emotional well-being, legal support, financial support, 24/7 support for employees. And currently we support over 12 million people who have access to the provision. One of my responsibilities, One of my responsibilities is to manage the referrals for counselling and for occupational health. We also have occupational health provision. So I oversee those, make sure that their individuals are placed with appropriate counsellors, psychologists, psychotherapists. But in addition to that, I also oversee our training network as well. So affiliate trainers, we obviously have to adapt to the way that we're doing, delivering training to our clients, but looking at the right types of practitioners to deliver things on mental health, resilience, stress management, nutrition, anything that enhances someone's life for the better, I guess. And we're a prevalent provision at the moment for many of our clients, given where we're at as a nation.
Just talk me, before we'll come on to some of the strategies that people might be able to learn from your experiences, but just tell us what life's been like over the last 10 weeks. How have you been operating, and how's your interaction with clients who are coming to you for advice? What's that been like these last 12 weeks?
Well, naturally, I mean, we're a 24/7 contact centre set up, all based in Manchester, with the counsellors and legal advisors on the helpline. Now, we've had to adapt, as everyone else had, in terms of home working. So we had been planning it when things started, there were whisperings around February time. We had our business continuity plan in place, and we were testing counsellors, advisors, case managers, all from different areas of the business and a home working capacity, making sure the systems were set up, telephone lines were all working. And luckily, when there was that overnight switch where we all had to rush home with our equipment, everything was set up and we were ready to go. So we have been functioning as business as usual in terms of the helpline, the support functions. Nothing has changed in terms of when a service user calls the helpline and looking for that immediate support, that counselling support, that legal support. Nothing has changed from their aspect, but we've had to adapt, just like everyone else, in terms of our workplace setups to manage those services.
Yeah, and have you been working from home personally? How have you found that?
Yeah, I have indeed. Bit of a shock to the system. Initially, we thought, 3 weeks, that's fine, not a problem. 3 weeks quickly turned into 10. Definitely, I think as a manager myself as well, people manager, as well as overseeing the service provisions, it's all about keeping open lines of communication with your teams, regular video. We're so used to this way now, I guess, 10 weeks on. For me, I don't have a dining room table or a study, so I was working from my bedroom, which was unusual to see my work set up the moment I sat up in the morning. Quickly became the new normal. And currently I'm testing out the return to work in the office, so observing kind of health and safety, making sure that's all working as it should.
Wow. So let's have a chat about the phrase return to work. Now, I think, for those of us, like I said, I work at a university. We've been quite effectively, I think, working from home, from our home settings. You've described your own personal situation. I think lots of people who work in city centres and business parks, punched over laptops, I guess professional people, in the professions and in office-based jobs, have been able to do that. There's obviously a whole swathe of the workforce either been on furlough or they've or they've lost their jobs entirely and they're out of the labour market. But there's a whole load of people who've been going to work and having to deal with the risks that involves as well. I think it's important not to forget that. And I'm sure there's, among that number, there's been many of your clients who you've been advising about working through this period of isolation. We've still got the government advice that when we return to work, we should practice social distancing. So I guess what I'm saying is there are learnings to take from businesses who've been working through this anyway. And we're not going back to any kind of normal immediately.
Absolutely.
It's very much a process of transition. So give us an idea then about how you're having those conversations, both inside your business, inside Health Assured and Peninsula, but also to your clients about gently moving towards that ending of lockdown and how you're advising businesses should go about it and how they communicate that.
Yeah, no, absolutely. So you're absolutely right. There has been a huge number of individuals that have not been able to work from home. They are essential workers, they are key workers. We've been supporting many of those as well through this process. A lot of people being frontline workers, so we've been supporting them in the moment. They've got 10 minutes before they have to move on to the next thing, come off their lunch, they want to sound off to a counsellor perhaps, so we're giving them in the moment coping mechanisms and strategies. But what we found when speaking with their employers, looking more at the kind of organisational level aspect of that, is making sure that the open lines of communication are there, but they're also consistent. And that is something that needs to be taken away for organisations that are now starting to plan and prepare their return to the workplace. With the situation being, when we reach certain peaks, I guess some of our frontline workers were absolutely in despair, didn't know what to do, how to cope with certain things, didn't know what to expect. And one of the biggest fears is the unknown, not knowing what to expect, and that's where a lot of the anxieties kind of come from. And that was for people working in the workplace still as frontline workers, but now what we've got to consider for those that are going from this 10 weeks of working at home or not working at all if they've been on furlough, or maybe they've been self-isolating or ill themselves, so they're having to go back to a whole new way of life. I think, like what you said, Michael, this isn't going to be going back to normal. There is a new normal now, and that is for everything, not just workplace, but your whole social interaction, the way you liaise with family and see your friends. But as part of this new normal, there's this fear, uncertainty, loss of control. And I think before people are starting to plan their return to work, for those that aren't already back in the workplace, it's not an overnight decision that needs to be made. You can't just expect employees to go overnight back into the workplace in the way that we overnight had to go back home when lockdown started. It's not, it can't be mirrored. That is not the way that you're going to get a successful return to work as an employer. One of the key parts of being able to have a successful return to work is ensuring that any risk posed by the virus is assessed, whether that's from a physical perspective, so your health and safety, have you done your workplace risk assessments, how are your employees getting back to the workplace, are they travelling on their own, are they travelling on public transport, is there a risk to the business functionality now, do the processes need to change, does the way that you need to work need to adapt, can't go back to the way that it was once upon a time. And who else is going to be in the workplace when you get them, get everyone back in? Are there people that have been impacted directly by coronavirus that you're expecting to be back in? People been symptomatic? Have people been self-isolating with people? So there's a huge risk assessment, not just from having your sanitising stations in place, but considering your actual workforce and how your organisation is expected to run when you're back in the workplace.
So just to be clear, it's obviously planning and preparation is absolutely key here. Yeah. And I just want to pick up on one of the really important points you made, just to summarise, is doing those workplace risk assessments, and also having that open conversation about people's anxieties that they might have and getting into work.
Yes.
There's a really important element about this, about the working day. I mean, I'm probably not atypical that, you know, I pile on a train at 7:43 on the rare occasions that it's on time. I don't fancy doing that anymore. What about coming in a bit later and just spreading it out? And I was talking to somebody on a chamber call the other day. Sorry, that's not a call that I had in a chamber. It was a call organised by the Greater Manchester Chamber of Commerce, where it was discussed, you know, double-decker buses, their capacity at the moment. And I checked this with a bus driver who I bumped into the other day. I said, how many people can you get on a Greater Manchester Stagecoach double-decker bus with social distancing measures in place? And it's about 20.
Yeah.
Now, I know hundreds of them go up and down Oxford Road, but not necessarily to other places. Trains, that's going to be, again, much, much reduced. So that's therefore going to put a great emphasis on people getting to work at different times. So an employer has to structure the workplace and how they get to work. And then therefore, then people might want to drive into work. Now, I know lots of civic authorities, Milan, for instance, want to exclude cars from the city centre to cut down on emissions and those sorts of things, which is all very laudable. But actually, the reality is the safest environment to isolate from infection is coming in their own car or with members of their own family. That's then going to put a great demand on car parking. You're just off the city centre. I don't know how many car parking spaces you've got access to. There's a great big arena across the road that isn't being used at the moment, and all those other car parks.
Yeah.
These big systemic issues are a massive challenge for planning and preparation for this return to work.
Yeah, absolutely. And I think it's all about understanding certain expectations and remaining flexible as an employer. Obviously, businesses need to be sustainable. They need to run, and you need to get to some kind of business as usual, whatever that then may look like. But I think employers, business owners, leaders, they need to be listening, acknowledging and accommodating reasonable expectations and with their employees. So I guess exploring, there needs to be that open conversation. They need to be able to listen to their employees, and their employees need to be allowed to be heard. You know, what are their concerns? What is their plan for returning to work themselves personally? How does that look for them? Is it public transport? Is it driving? Are they lucky enough to live in, you know, close proximity to walk or cycle? But from that, businesses do need to start exploring flexible working conditions. Now, this might not be forever. So until a vaccine is on the horizon, I mean, we're probably looking, this is short to mid-term for these adjustments, I guess. So if someone needs to start work later because they need to avoid the peak rush on public transport. So I've tested going on the Metro Link myself, coming out from Chorlton. It's only 20 minutes on the tram, but it is an unusual experience. I was all PPE'd up to the nines, but a lot of people weren't. So there's going to be anxieties around how everyone else is acting around them. That's what employers are going to be worried about. Well, what if, you know, there's people that aren't following the rules, especially next week when the rule to wear masks comes into play. People won't necessarily follow those rules, and that's going to be quite difficult to police as a nation. So people are going to have those anxieties. Maybe so in the lead up to someone's return to work, almost like coming back from maternity leave, those kit days, those keeping in touch, get people used to coming back to the workplace. Do a trial run of public transport at a time you think might be better. Allow that flexibility for them, you know, if they're not going to be in at 9 on the dot because they are trialing a different time out on public transport. Be open and flexible with that. If you're being reasonable at the beginning and that transition period back into the workplace, you're going to get that engagement. And those employees are going to be more receptive to the changes and expectations of them in the workplace as well.
Would you suggest doing surveys of staff about what their expectations? Is that a good way of gauging opinion?
Yeah, absolutely. I think if you've already got people in the workplace, people may have already started doing this. So we've had clients, for example, where it's absolutely critical their employees have to remain in the workplace, whether that's because they have no internet connection, it's not confidential, they are, you know, maybe in a house share, that kind of thing. It is not possible for them to work, but they're critical to the business. They have worked in offices, for example. And what they have done, certain employers in those situations, is use them to spread positive gossip. Talk about the precautions that have been put in place in the workplace. The risk assessments have been done. They're COVID secure in terms of hygiene, cleanliness, the precautions that are being put in place. They can go, look, there's arrows on the floor for a one-way system. There's sanitising stations at the end of every bank of desks. However that may look, but it's getting them to use their personal experiences as well. If there has been minimal numbers in the workplace, we've seen that be... People are going to listen to their peers. They're going to listen to the ones that they trust. They speak with outside of work. And if they've spoken with such a body after work who's been in the workplace for a number of weeks, they're going to hear those good things. And I think that's a really useful tool. And it's free. It's not, you're not having to pay for professional support to ease someone's anxieties. It's peer-to-peer support, and it doesn't cost anything at all.
Can I ask you about, there's going to be some really awkward situations in workplaces where there are some staff who've been on furlough.
Yes.
And they'll be returning to work. What sort of issues do you anticipate, or have you already dealt with, around managing that relationship between staff who are coming back to work off furlough and how they might interact with staff who were deemed too important to furlough? I mean, that's how it could come across, isn't it?
Yeah, absolutely. And I think the feeling around furloughed employees has changed over the past 10 weeks. I think the focus was on people questioning, why have I been put on? Why have I been furloughed? Why have I been furloughed? And actually, they've lent into it. They're leaning into it. They've enjoyed this time. This is never going to happen again, where they're going to get this extra quality time with people. To now shifting on the other side, where their colleagues are resentful of them. They've had X amount of weeks off. They feel like they've had to shoulder the burden and increase their workloads themselves. There's quite a lot of resentment, jealousy that we've seen, and it's kind of I guess, looking at conflict management skills, because there is going to be that resentment when they're back in the workplace. You might get snide comments, that kind of thing, digs. Very unprofessional, but it's human as well to kind of, for some people to act like that. So it's there needs to be a really robust plan in place for furlough workers. I think initially, again, we all thought 3 weeks, that's fine, some extra leave, just have a nice little jolly. But it's not. It's been extended and extended and extended, and now these people are going to be coming back into a workplace that they are not privy to, they're not aligned with anymore. If you haven't been having regular welfare calls, for example, with your furloughed staff, keeping them up to date, now is the time to start doing that if you are thinking about getting them back in to the workplace. They have no idea what the business looks like anymore. They don't know what's been happening. They don't know what processes have changed. They don't know how the client service user, however the business runs, they don't know how the operational side has been going. They are going to be coming in, again, very similar to people on maternity, for example. With no clue. They need to be treated again like new starters, go through that onboarding process. They need to be retrained in certain things, monitored, supervised, to ensure they're doing everything correctly, but also very similar to a new starter, those regular daily, weekly check-ins, however your onboarding process looks.
So have you been advising that your clients do that they have those regular keep in touch?
Absolutely. I mean, not even to give, because sometimes an update might not be business appropriate. There might not be a change in the business. You are keeping ticking over. So from 1 week to the next, there might not be any process changes, or let me keep you in the loop with how this service is looking. Just keep in touch with them and it has to 5 minutes tops. How are you doing? How's the family? Been going out for your walks? Been doing anything else? Just keeping and checking in on their welfare, their well-being. Have they got any concerns? Do you have any concerns about them? They might have also been impacted by the virus. So yes, they might be on furlough. They're not worrying about work necessarily, but they may have had a bereavement. They may have partners that have suffered financially, for example, childcare concerns. Check in with them and have that human chat as you would in the workplace, going, "Hi Michael, you okay? How was your evening last night?" You need to still have those chats as a manager, team leader, supervisor, however that working relationship is. I would recommend weekly. There's no rule in place. It's how you feel that you know your teams, you know how they work, you know how they respond to you as your manager, as their manager. But I would keep those very, very regular lines of communication ongoing as well.
So give us some idea about what sort of signposting and additional support and other external professional services that that people can access that you'd be able to provide in order to manage this transition from either from furloughing or returning to the office or the workplace, whatever it is.
Yeah, absolutely. So, I mean, even as managers, business owners, leaders, not miracle workers, we don't know the answers to everything. We're not clinical professionals, mental health practitioners. You need to utilise any other external or even internal support systems that you have within the organisation. People are going to start feeling very apprehensive about this return to work, and if you're not already collaborating or have partnerships with certain things like occupational health or employee assistance programs, maybe now is the time to start thinking about it, if that is justifiable from a financial perspective. There are zero cost ways of being able to support and be able to signpost. You can start peer-to-peer support, buddy systems, wellbeing groups, mental health champions. There is an abundance of online mental health educational courses, free courses that you can upskill certain people within the business on to become those points of contact if you are not in a position to have an EAP or occupational health, for example. But also, in addition to that, there's voluntary helplines as well. You aren't the counsellor. So if someone is really at a point of a certain level of anxiety or stress, you can't, if you're not a mental health first aider or a counsellor or a psychologist in yourself, you can't be expected necessarily to deal in the moment with any kind of risk or crisis. There are those free support helplines. The GP as well is a really useful tool to signpost to as well for individuals. But it's, as a zero cost way, I'd probably start exploring those peer-to-peer supports. People can go through courses that are free online, for example, on how to do active listening. So really good for team leaders and managers, so active listening courses, coping strategies, mechanisms, things like mindfulness. I do a little bit of mindfulness at my desk. I've got an abundance of emails, I've got a couple of meetings, that kind of thing. There's very, couple of minute exercises that people can be doing. So it's really, really important that I think that managers, business owners take this opportunity to upskill themselves, because supporting mental health in the workplace in general, not just in the return to work through COVID, it's not just a moral thing to do. It is a duty of care, and there is a legal responsibility under, occupational health and support as well.
And presumably your experience is that practicing these things, it's good for business as well. Take the holistic view. If your employees are happy, trusted, stable, are in a good place, they're more likely to be productive, and it's a good investment to make in your workforce, to be, brutally cynical about it.
Absolutely. And I think we're now in an age, it's very different now because we're in the pandemic, and this is something, that many people haven't experienced. The most similar thing to this, I guess, was World War II, when society changed as a whole. But mental health in the workplace isn't a stigma as it was once upon a time. People are very open to talk about their anxieties. Sometimes you can't stop people from talking about it, and that's great. They're really open, and it's all over social media and LinkedIn, and they're talking about it in the workplace. But the issues are then the managers, business owners, leaders, confidence and competence to have those conversations. You don't think twice about going, how's your cold coming on, Michael? You're getting better, you're less stuffy. But you wouldn't go up to someone and go, how's your anxiety coming along, Michael? There's a very different way of having those conversations. But managers are extremely cautious. They don't want to say the wrong thing. They want to still remain appropriate and professional. They're scared of getting into certain territories that they might not feel comfortable in doing so. But when people are upskilling themselves as leaders, their workforce are going to see them as open, non-judgmental. There's an honest, transparent culture within the workplace. You're going to absolutely get them engaged. They're going to be thriving, flourishing within the workplace. And you're going to start to see things, you know, if you do pulse surveys, engagement surveys, that kind of thing, as anonymous surveys, your feedback on things online, you know, the Glassdoor and Indeed, those kind of things. If you're starting to put that out there, and it is at zero cost, you don't have to invest in something necessarily like an EAP or an occupational health necessarily. It is taking that time to just go through those, learning, you know, spending half an hour learning how to spot signs and symptoms and changes in people, and the accompanying coping strategies that you can recommend to someone will turn something around, you know, 360 in terms of conversations with their staff.
Good. I'm going to invite people who are watching live to submit any questions that they might have. I mean, we've got plenty to get through, and there's a few things I wanted to ask you, but I will be looking at the button that comes up on my screen that tells me what questions I've had in from people who've tuned in, logged in, zoomed in, whatever we call it. But I mean, you touched on stress and anxieties, and if anything, it is a difficult subject to raise. It is a tricky area to navigate, and it's new territory for lots of people in management situations, but alongside with colleagues, but also as an individual, your own self-awareness about what might be happening to you. And clearly, this isn't unique to the period that we're coming through, but I would anticipate that it's a time of heightened stress and heightened anxiety. So give us a few examples of how you define, how you spot, and how you deal with stress and anxiety, and just sort of understand the difference between the two. And what sort of symptoms fall into those different categories, because it is, I think, for a lot of people, a tricky area to navigate, which is why they would turn to Health Assured and to you to help them through this.
Absolutely. So, I mean, it's really important that you don't, a lot of people confuse stress and anxiety or put them in the same bag as each other. They're two very, very different things. And stress is the state of the mental or emotional strain or tension when faced with something in demanding circumstances. So it's the mental state as opposed to the physical feeling, which is then linked to anxiety. So anxiety is that feeling of worry, the feeling of nervousness, the feeling of unease when they don't know what an outcome is going to be in a certain situation. So two quite different things. The two are not bad things to experience. I'm pretty confident we can say that most people have experienced one or the other or both. And stress, as long it's all dependent on the energy that you've got available to deal with that. Anxiety is the fight, flight or freeze situation. So I'm sure many people that are kind of listening in or have felt that, and they don't know what to do in certain situations. So it's identifying the difference between the two. By not proactively addressing certain anxieties, that people or feelings of stress, people are going to become more likely to develop certain mental health conditions, and that will escalate and become something that could be avoided if they're not addressed quite early on, like an early intervention approach. And you can notice changes, you can notice symptoms in yourself or your staff by looking at the cognitive changes, so the way that your brain is processing certain things, behaviours, emotions and physiological, so the way that your body is reacting to certain things as well. So I guess in this instance, ways to identify if someone is feeling anxious about the situation of returning to work in this specific scenario, you will see potentially a reluctance to return to the workplace. You will see people perhaps overreacting to certain issues, maybe a reluctance to connect with you as their manager, their leader, or even their peers. They might become quite withdrawn and start cutting off because they're starting to get that fear now. I've got to go back to the workplace, and there's a shutdown, a mental shutdown in them. And things like your behaviours, so sleeping too much, sleeping too little, overeating, or undereating, not having an appetite at all. low self-esteem, low morale. So very similar to the changes in behaviours and signs that you see with someone that's struggling with anxiety in general, but you'll start to see they're very, very much work related. They might start being less productive. There might be procrastination, neglecting responsibilities as well. So start to see those as red flags, because that's when you need to start having open conversations, as you would when you'd normally address issues, if there are any with employees. Don't be afraid to have those open conversations, because it's highly likely that that is linked to the fact they are dreading the thought of coming back into work, for example, if they are working from home and coming back into the workplace.
So we've talked about planning preparation. We've talked about the issues around, I guess what you're touching on there is a workplace culture,
Yes,
and how that's engendered, how that's encouraged.
Yeah.
And I'm getting some very strong signals about what you personally would regard as a positive workplace culture that would encourage openness and support a nurturing environment. Let's just take it down. I've got a question that somebody sent in that they prefer not to be identified.
Okay.
It's a really good question, and I think it's probably not atypical of the sort of client base for Health Assured Peninsula. This person manages a relatively small team of 30 people, close knit. In normal circumstances, you're already visualizing what that looks like. They've had to make some redundancies, and therefore they've got people who are they're coming back to work after this lockdown. They all watch the briefings, they all watch the news, they all see what's going on around in the world. And some people could be coming back to work, back into the workplace at least, with a very negative attitude and a very fearful way. They could be looking for a new job, or maybe there aren't the opportunities to move on because the economy is slowing down. So how can these people support their staff in feeling reassured and stopping the negativity that could run rampant through workplaces during this period? I think that touches on where I think you were going on that last point about culture. It's
absolutely.
Very good question.
Yeah, that's a really, really good question, because again, it highlights as well the need for open communication and people and the employees being part of this process of change. If they are feeling uncertain, perhaps unsupported as well, they need to be part of this transition. There's probably a lot going on behind the scenes. I get that, that there is a lot of organisational change to put into place processes, how clients are being serviced, for example. But the staff need to be part of that. They don't need to know all, they don't need to sit and look at the blueprints for it, but you need to be communicating those changes and highlighting a timeline as well. We don't know. It is all very finger in the air. There could even be a second lockdown, which we need to be prepared for if that does happen. But currently, what is your time scale? What are we expected to achieve and when? And what does our role, our processes look like at these certain milestones? That is extremely important, but you need to know what that is before you start sharing information with them. Don't start guessing or surmising if you're waiting from someone above you to give that message. But be honest, you are waiting for that information. You have to be honest with those employees. Don't keep them in the dark and don't fob them off, which I think can happen. We're all running, blind at the moment, bumping into one another, trying to guess what's going on. Be honest. If you don't know the answer, you're waiting for that information, and you're going to be communicating those next steps out and how everything is planned and forecasted to look in the next 2 weeks, 2 months, 6 months, because we don't know, but there needs to be some kind of idea, and they need to be part of that.
Yeah, another question just coming on from that someone sent in is there anything that managers, owners can put in place to allow staff to have a sounding board for how they feel and what their thoughts are about coming back to the office? They're conscious, obviously, that not everybody will want to stand up and, in a team meeting, if those things are still happening, or on a Zoom call like this. I go on Zoom calls with the team I work in. There's 22 of us. The loudest voices, usually me and a few others. We're not afraid to talk a lot. Other people I've not heard a peep out of in 3 months, and that could be their only interaction with staff. It could be very passive. That people have retreated into types and personalities. There's different ages as well. So how do you set up those sounding boards? What examples have you got, for instance, of
No, absolutely. There's a couple of different ways
mechanisms
there's a couple of different ways that you can look to do something like this. It all depends on kind of things like digital capacity as well. So some people, you may have the ability to set up a centralized inbox, for example, and one person has access to that inbox. Now that one person, I wouldn't necessarily suggest it's an exec or someone high up in senior leadership, because people can be quite apprehensive about giving. It's almost like having a suggestion box, but we're not in a position to have suggestion box. That's not something we can do at the moment. An employee feedback inbox, for example, anything that they think will improve processes, improve morale, well-being, email those suggestions to there, and the designated person for that inbox, for example, will just collate that information and give it as a exec summary, perhaps, to those that are able to make process changes or changes within the workplace. So that has worked really well, but it's making it very, very clear that, and assuring people that only XYZ person has access to this and collates the information. Another way, if people are happy to talk, especially in these situations, is to look at maybe well-being groups, like focus groups. Don't choose your managers of departments, don't choose team leaders or your senior people, whoever that may be, your deputies. Choose an employee from each department. Get them to volunteer if they want to, but reach out to people that you think have a lot to say but don't know the right platform to do that. Bring them together once a month. You might want to do it more regularly than that, but then share best practice. Talk about things that they've heard from their peers, their colleagues, things they're worried about. They don't have to break confidentiality, just want to get a sense of everything without it becoming a soapbox. You don't want it to become a place where people will attack processes, for example. But have someone to facilitate that. Someone, again, don't need to be in leadership, because you want to have that element of trust there, but someone that has a really great relationship with employees and then the decision makers, the execs, the management, for example. Use them to facilitate and kind of mediate a session where you're sharing best practice, looking at processes, looking at ways to support one another, and they can then summarize that and give that in a brief report if they need to, about how proposed changes could make a difference.
That's good. There's a couple of other issues that have come up from people expressing their own individual circumstances they want some help with. One of them's almost the types of everybody's personal circumstances will be unique to them, self-evidently, as they come back into the workplace. But there are obviously people coming in from there'll be people who will still be required to work from home because of the social distancing measures. I think a lot of workspaces, a lot of us have been seduced by this idea about hot desking and play areas and pool tables and pinball machines for those of us who work in, those of you who work in social media agencies in the northern quarter of Manchester and Shoreditch and London, etc., etc. Okay, but they're going to have to. A lot of businesses are going to have to keep numbers down. So there's some working from home, some being required to come in. But there's another divide as well, and that's parents. Yeah. I mean, I think it's always been there about the kind of rights and the fact that those of us who've had school-age children have had to pay that premium in July and August for expensive holidays and all those sorts of things. How do you manage those sorts of issues around the expectations of parents who are going to still have to not return to work because their schools and nurseries in different settings aren't going to be open until September? So there's the continuing to work from home divide, and then there's the parents, the breeders against the against the people without children.
So with the divide, I think this is where you need to, dependent on the volumes within your workforce, you need to be, obviously when you're putting your plan in place to return people to the workplace, you need to be identifying those that are going to come into the workplace without there being anything else to worry about. So for example, prioritise the ones that have got their own car, don't necessarily have childcare concerns, no children, that kind of thing. So the people that are able to just come straight into work and not have to worry about putting other plans in place for whatever else is going on at home, look at those first, start having those conversations with them. Do they want to be the first coming back into the workplace? Share your evidence of how the workplace looks at the moment, get them to come in first. That's what you need to look at. And then you need to be almost, again, this is not a black and white rule, I'm not an employment law advisor, talking about best practice here, is giving them an opportunity to volunteer. Some people may have the childcare issues covered at home, the partner might already be there, they're able to homeschool them, however that looks. People might bite your hand off to come back to the workplace, so you need to put it out to them. Don't just say, you are all coming back in on Monday morning. See you then, bye. You need to be having those continuous conversations, and then that's when you need to start looking at the reasonable adjustments. Like I mentioned before, these reasonable adjustments might only be short to mid-term. So when you're getting into September, when we're pretty certain that all the schools will kind of be back to how it used to be, or as close to that as possible, this is realistically July's 3 months, 3 months really. So it is very short term in terms of temporary adjustments, if they need to continue working at home. But I would look at your workforce as a whole and understand who doesn't fit into that category of having those additional responsibilities. To be quite honest, you'll see that people will snap your hand off to come back into the workplace. It really does help create a divide. You're not moving from the dining room to the sofa. You're actually creating some lines between work and home. The divide, whilst you've still got people at home and you've got people in work, really good. You need to keep up with some of the habits we've picked up during lockdown. Some of them haven't been bad. Some of them aren't all wearing yoga pants at your desk. We've actually picked up some good habits, and that is this way of communicating. I feel like I've spoken to my teams more, and we've spoken about more productive things and resolved issues a lot faster by having this kind of setup, I guess. And that needs to maintain. Let's keep that in place. That's a good habit to maintain whilst we're going back through this, going back to work. Keep in touch with keep the office staff, the workplace staff, in communication with the home-based staff still. I would probably look at doing things like keeping up those good habits of team meetings. You don't want people to feel like they're being left out. If you're back in the workplace and you can get 4 people in a boardroom, perhaps, continue with these styles of meeting with your staff. Not only does it reduce any physical risk, even if you can put 4 people in a boardroom, it keeps the home workers still part of the team, like nothing has changed in that respect.
Brilliant. Listen, we've hit 40 minutes, which I thought was
Nick?
I thought we'd sustain a conversation for that long. I can't go beyond an hour, but I think for the purposes of a decent run around the block for people, if they want to listen to this later on as a podcast, that's been excellent. I think the main summary that we take from this is be honest with people. I think you're giving that message. Listen. All managers need to actively listen to what their employees are saying. Clearly, be honest with them about the long-term, short-term, middle-term view about what's involved, that everybody else is in a different situation, but also create those feedback loops. So yes. To make sure that there is that opportunity for people to express how they're feeling in a safe and confidential way. So, Kayleigh, thank you so much for giving your time to this Live Better podcast. Wherever you are, wherever you're watching this, whether you're listening to the recording, thank you very much for your time. But more than ever, thank Kayleigh from Health Assured for your insights, and I hope people have found them to be useful.
Thank you.
Have a great day, whatever it is that you're doing, and look forward to you joining us on the next Live Better podcast. But more than anything, hopefully we'll all be getting together very, very soon on another occasion in person when this is all blown over. Thank you.